Hello and welcome to yet another episode of the Health and Wellness Show. My name is Chebet Birir, and kama kawaida, this is where we inform you, we empower you, and we inspire you to take full control of your health and live your best life. Now today we are talking about epilepsy. Epilepsy is a neurological condition that affects 1 in 100 people in Kenya. That means that more than 400,000 people in Kenya are living with epilepsy, or they have just been diagnosed with epilepsy. And so today we want to understand what epilepsy is, what are the causes, and how do you manage epilepsy. Karibuni sana to the show. And with me on set, I have Samuel Ouma, who is a person living with epilepsy. So he will help us understand how it has been for him since diagnosis and how he's managing it. Karibu sana, Sam. And thank you for agreeing to come on the show today. Next, we have Wanjiru Stephany, who is also living with epilepsy, and she'll also tell us, your experience and the journey with epilepsy and how you're managing it. And last but not least, we have Nicholas Otieno, who is a clinician or an epileptimologist. Epileptologist. That's a complex word there, but he deals with people living with epilepsy probably on a daily basis. That's your job. You're specialized on that. So you'll tell us what causes it, how is it managed and treated. Karibuni sana to the show. Now I want us to start with you, Sam.
Yes.
In many cultures, epilepsy ni kitu tunaogopa sana. People wanaogopa, inaitwa kifafa, So how was it for you ukiwa diagnosed with epilepsy, and when was this?
Kwanza venye umeanza na ukasema ni kitu inatisha.
Ni kitu inaogopesha watu.
Inaogopesha sana. Epilepsy, kwanza nitaanza nikisema kwamba si uchawi na si uganga na si uenda wazimu. Epilepsy is a brain condition. Na since nikuwa diagnosed kwamba nina epilepsy, naishi na epilepsy ni 2013 till today. Na sasa hapa kwanza wakati nilianza kuanguka in public na wapi, mostly I lost friends, nikabaki ni kama sina rafiki, sina mtu yeyote karibu na mimi. Na niliishi pia kwa uoga, niliishi kujihurumia, why me alone, kwa sababu ni kitu inakuangusha mahali popote. Mahali popote inakuangusha. Na pia tulijaribu kutembea na wazazi tukitafuta tiba. Ili tulikuwa tunajua ni mapepo vile nilianza ama ni uchawi. So tulitembea kwa maombi, sehemu mbalimbali, tulitembea kwa matibabu.
Na ulikuwa miaka ngapi ukianza?
Ikianza nilikuwa around 18 years.
Okay. Na sasa uko na miaka mingapi?
Sasa niko na 30. 30.
So almost 15 years.
15 years.
Almost. Yeah.
Yeah.
So yes, so
tukazunguka tukaenda Tororo Uganda, na Maingo Uganda, tukarudi Kenya, tukapata wengine. Unafika kwa mtu anakuomba 15,000 anakuambia inaisha leo. Chukua hii kitu, enda fanya hivi, itaisha leo hii. So unachukua ile dawa anakuambia uende utupe kwa mto, itaishia hapo hiyo siku. Ukienda utupe kwa mto hivyo eti imeenda na kifafa, kumbe ndo sasa umeita usiku, hautalala. So kifafa ni kitu ambayo inachanganya watu sana. Na watu pia niseme hao madaktari wa kienyeji na waombaji wanachukulia advantage ili waweze kupata pesa. Sasa nilihangaika, tumetafuta matibabu. Kama iko mtoto wa wazazi wangu ambaye amekuwa invested in, ni mimi kufuatana na hiyo condition.
Okay.
So nimetembea kila mahali, sikuwahi jua ni condition ambayo iko kwenye ubongo whereby inakuwa followed up na madaktari. Nilijua ni kitu nilitumiwa. The reason why iliaminika hivyo kwa kijiji ni because nilikuwa naelekea kufanya mtihani wa darasa la 8. Okay. So ikaaminika kwa nini tu anaelekea kufanya mtihani na hii inamkujia. So it means either aliruka kwa barabara ama alitransfaiwa kutoka kwa mtu mwingine ikakuja kwake, na kulingana na venye nimefuatilia hakuna kifafa ambao unaweza transfer kutoka kwa mtu to another.
Na asante sana Sam, na tutarudi kwako sasa utuelezee the journey after, the continuous after ukazunguka vile ulipata the right treatment ama the right information about your condition. But wacha tusikize Stephany, for you how was it na ilianza vipi?
For me, what I can say about epilepsy, me, I know it is a disorder in the brain. So with me, I have been born with it.
Okay.
I had a birth complication, so that triggered the epilepsy to occur. And with the journey, it has not been easy, but I just had to cope with it and live with it the way it was. And with that, the way the people say ni uchawi ama uganga ama nini, I just was not trusting on that. We were just coming to the clinics, doing what the doctor says, and with time it has at least been much better because it was not that easy.
Okay. And had you, like, how were you informed that you have epilepsy?
When I was young, I was not behaving normally, so it was not that well. People were scared, were thinking I will die. So when I was born, it was not that well. The doctor actually woke me up with the spirit on it because I was not breathing. So when I was born, because the spirit is cold, it actually made me have a trigger on the coldness on that.
Okay.
So that is how it was. Yeah.
Asante sana, and we'll come back to both of you to explain to us further how you've been managing the condition. But let Nicholas here, who is a clinician and please tell me that word. Epileptomologist. You handle these cases very often. So please tell us what causes it first. Ni nini ina cause epilepsy?
So basically, epilepsy, as you introduced it, is a neurological condition.
Yes.
Meaning that it works on the central nervous system. And most people confuse it with supernatural activities. And that is why there's a lot of stigma, whatever they are saying,
yes,
that they've gone through all kinds of witch doctors, they've gone through prayers, which are also manipulative. So basically, epilepsy is caused by so many things. So in summary, we usually say that anything that will interfere with your brain function will cause epilepsy. And to understand those things easier, we always divide them into three. We have the prenatal causes, we have the natal causes, and we have the postnatal causes. The prenatal causes are the causes that happen when the child is still in the mother's womb. So these are situations where a mother might have injuries, like trauma in the abdomen, might have infections, like when you go for ANC clinics, they do an ANC profile. The ANC profile entails some of the tests which are done. You have urinary tract infection tested, you have HIV being tested, and you have many other conditions, even hepatitis being tested. The reason why they do all these tests is to make sure that this fetus within the uterus is safe.
Okay.
And to make sure that everything, the monitoring happens at least when a mother is pregnant, you should have at least 4 visits. So within these 4 visits, they are doing monitoring. They're ensuring that the child is okay. You have issues like microcephaly. If you don't go to the health facility, they will not be noticed. We have issues like hydrocephaly. If the mothers don't go to the facilities, they will not be noticed. Then we have the natal causes. The natal causes are now the causes that happen during delivery. The delivery process must be handled with the care that it deserves. This means that we are pushing for 100% hospital delivery. The 100% hospital delivery is to make sure that all mothers deliver in hospital, because we are sure that the environment in that hospital facility is safe. We have situations where mothers go through prolonged labor. When they are delivering at home, they won't know that this thing is prolonged, and this might expose the child into having epilepsy. We have things like trauma. Baby delivered and there was no enough caution. The child might fall during the process of delivery. This might cause epilepsy in future. Then we have the postnatal causes. Now this is where immunizations come in. We have conditions like meningitis, we have conditions like TB, we have even conditions like cerebral malaria. If not managed properly, they might lead into a person having epilepsy. We have other conditions like head injuries. Now this one comes when a person is now an adult. Things like head injuries, we have road traffic accidents, we have some medications that can lead into seizures if not given properly. We have poisoning. So there are so many things. We even have stress and anger. So there anything that will interfere with your brain function can cause epilepsy.
Lead to epilepsy.
Yes.
We also have cases of infections like meningitis. Can that also lead to epilepsy?
Yeah, that is one of the major causes of epilepsy because meningitis is an infection within the brain. So when the brain is infected, these persons might be treated and the meningitis is gone. We have other conditions like TB which also affect in the same way. After that treatment, you might find a person having seizures. So these are some of the causes that will lead one into having epilepsy, and you'll find that 60% of the patients that we manage will tell you that they don't understand where it came from.
Okay.
We have, they are called idiopathic causes.
Yes.
So no one is really aware of the source of the epilepsy.
Yes.
We also have cryptogenic causes. Cryptogenic causes are causes where there's an idea of where it might have come from. This guy was playing football. He had some concussion
Happened.
but no investigation was done. And this guy has started having seizures. You are not sure if that is the cause, but it could be the cause. That is the cryptogenic. Then we have the symptomatic. Now you are sure that this is what caused the epilepsy. So there are three classifications.
A stroke, meningitis.
Yes.
Okay.
So there are three classifications of the causes.
Thank you, Nicholas. Now, before we go back to Sam and Stephany, what happens when someone has a seizure? Because that is the most common symptom of epilepsy. I know you'll talk about the other symptoms later. But now the seizure, mtu akikuwa na convulsions, what is going on in the brain?
So basically what brings a seizure is all our brains function through electrical discharges. And the electrical discharges that are produced within our brains should be within a particular limit. So what happens when a seizure comes is there is an excessive production of these electrical discharges. And these electrical discharges have been produced within the brain. So they'll have to work within the brain. So literally your brain electrocutes itself.
Okay.
That is how you get a seizure. The seizure is a physical manifestation of what has happened
in your brain. So and it's like an electrocution.
Yes, it's literally an electrocution.
Literally an electrocution within your
Yes,
your
and
brain.
It happens in two parts. There's the partial seizures and there's the generalized seizures. In partial seizures, a part of the brain has been hit. In the generalized seizure, the whole brain has been hit. So in the partial seizures, they are again divided into three.
Okay, and we'll come back. We'll come back there. Yes. But Samuel, unakumbuka the first time ukikuwa na hiyo seizure? Ukiwa umesema 18 years?
Yeah, 18 years.
Do you remember how it happened?
Firstly, it came at night. I was in a sleep. So while I was in a sleep, I didn't realize what really happened. Though there was a person who witnessed. So in the morning, she questioned me.
But did you feel it? Ama wewe uliamka tu ukaambiwa ulikuwa na convulsions?
Wakati niliamka, I felt like I'm tired. So I used to ask myself, ni nini imefanyika? Juu nasikia kichwa inauma, nasikia I'm tired, so I don't understand what has happened. So till the person came and questioned me, unakuanga na shida ama ni nini? Juu usiku umesumbukana sana. Nikamwambia sikuangi na shida, but pia mimi nime feel like I'm not okay. So akaniambia usiku umesumbukana, sasa ngoja the following night tuone what will follow. So the following night the same thing happened. So when it happened, nikazidi kujiuliza sasa ni nini. So that is when, and it used to come only at night.
Only at night?
Only at night. I was told by the doctor it's called the nocturnal attack.
Okay.
So
Nicholas tatueleza zaidi.
It comes at night. So nikilala tu tena at a specific time kuanzia saa 6 mpaka saa 9.
Okay.
So that is when
The convulsions
come. So hapo ndo ilizidi kuaminika kwamba ni nini?
Urogi.
Mapepo.
Murushiwa kitu kama mapepo.
Nasukumiwa kitu fulani. A certain power that is trying to disturb me.
Okay.
So tukaanza kuenda kwa hiyo matibabu vile nilisema. So tulienda kwa waganga wote, haikusaidika kwa machurches. Hatukusaidika. So mtu mmoja akatuambia try St. Anton's Tororo Hospital.
Okay.
So tukaenda huko. Kwenda huko wakatuambia kwanza waliitisha medical history. Medical history ni yule mtu huwa ana witness what happens during the attack. So Shosh alipeana medical history, akasema vile huwa anaanguka. So wakasema this might be epilepsy. They were not sure. So wakaandika, because we had no money to do the tests, wakaniandikia dawa fulani, carbamazepine, phenobab and folic acid. So wakasema endeni mjaribu hii dawa muone kama kutakuwa na changes. Hiyo usiku vile nilimeza dawa, nothing happened. The following night ikakuja kidogo, ikapotea. Haikukuja ile full, ile the way amesema.
Na hiyo bado ulikuwa una feel ama haufeel, unaambiwa tu asubuhi?
I feel sasa ilikuwa inaanza kukujia kwa hii mguu. Mguu inajikunja hivi, inatetemeka and then the whole body converse. So kutoka hapo nilikuwa naenda form 1, nikaenda form 1, ikazidi sasa nikiwa secondary school. Kazidi though nilika maintain tu dawa.
Hiyo dawa tu. So bila tests, bado hujafanyiwa
bila test. So pesa ikapatikana, tukaenda Busia referral hospital. Hapo ndo nikafanyiwa test. Wakasema ni epilepsy. So marafiki zangu na nani hapa home hawakuwahi jua nini na happening, because it only come at night. So hakuna mtu alirealize sikuanguka in public, sikufanya nini. But sasa kuna siku iliniangusha kwa moto. That's when now the community came into realization that huwa na undergo seizures.
Okay. Tutarudi kwako Sam. Asante sana and thank you for being strong and kusema experience yako si rahisi na sio kila mtu anaweza kukua open enough kuongelea epilepsy. Sasa tukuje kwako Stephany. Wewe umesema you were born with it, but do you remember the first time and how was the experience? Not the first time, but do you remember feeling it? Like the first time you felt it?
When I was young, it was not that easy. But when I have been growing, I've been noticing something was not well, and it was not me. I was not feeling myself. So with time, when I was growing, the way our body has the hormone imbalance, changes. So when I started having my periods, changes came, and I noticed even the ovulation were changing. So I was not feeling myself well. Things were changing, so I had to tell the doctor, and the medications were changed. So with that, I noticed that it was not that easy, but with time I coped and I got better, and I just had to live the way life was, and I got better.
Okay.
Yeah.
But have you do you remember when you have the convulsions, how do you feel?
Well, with time, before I was not even hearing it coming.
Okay.
So after taking the medication well, I felt, and I usually feel it, and I see it. So when it comes, I notice when it comes, and I get ready when maybe I have things. I put them aside, or maybe when I'm cooking, I put the gas off, and I see it. So it reacts but nowadays it is not reacting like the way it was. So this means that it is getting better.
Okay.
Yeah.
All right. Thank you, Stephany, also for, you know, speaking about the condition.
Yeah.
And we're about to take a break, but before that, Nicholas, please tell us, like, when somebody experiences that seizure, what should we do? Like, what should one do? Like, it has been diagnosed, or even before it gets diagnosed. You know, many people wanasema, unampea kijiko ama kitu aume. Is it right? And just tell us what needs to be done.
So basically, when a person is having a seizure, most people panic.
Yes.
And the moment they panic, most of them will run away. Some, when they don't run away, they'll look for spoons and all these other
Items,
things
yeah.
that they put in the patient's mouth, assuming that they are preventing the tongue from being bitten or from them swallowing their tongue. One, you should not put anything in a patient's mouth when he's having a seizure. Two, you should not try to restrain the patient, trying to stop the process. Allow the process to continue. Some people will try to give them drinks and medication during a seizure. You're not supposed to do any of that. So what you're supposed to do in case of a seizure is, first, you stay calm. The moment you're calm, you can think. The second thing, you ensure that that head is, the environment that the patient is in is safe. Safety means that if there is anything that can cause injuries to this patient and you, make sure that they are removed. Then the third thing, you ensure that the patient's head is safe. Making sure that the patient's head is safe is, if I have something like a clothing, or if I'm in an environment where I can get a pillow, I put it under the head. Then after that, I am supposed to, if the patient is wearing a tie or a belt, I loosen the ties and the belt. Consider that the first thing I did was timing the seizure. Any seizure below 5 minutes is safe. Any seizure above 5 minutes, that is when you need to seek for medical attention.
Okay.
Yeah, so after loosening the clothing, allow the process to continue. Don't try to restrain the patient. Don't try to carry the patient. Don't put anything in the mouth. Don't even give them anything to drink or medication to take. So after the process is done, they will shake for like 3 minutes, maximum 5 minutes. After they are done with all that movement, put them in recovery position. Recovery position is where the head is, the patient is lying on the side, first of all.
Which side? Left?
Left or right, any.
Okay.
Yeah, so once the patient is lying on the side, you ensure that the head is tilted upwards. The reason why you're tilting the head upwards is to make sure that the patient continues breathing. Then one of your hands should be on the patient's chin, just to make sure that not the chin, the side, to make sure that the patient's head is still supported.
Okay.
As that continues, the lower leg is flat on the ground. The upper leg is usually at an angle of 90. The reason why it is at an angle of 90 is to make sure that this patient does not roll and lie using the abdomen. So you ensure that the patient is on the side and that the breathing is continuous. So if the patient stays in that situation for like 30 minutes, consider the seizures are already done.
Yes.
So it's only that the patient has not recovered. The consciousness is not yet back. If it takes 30 minutes, take the patient to the other side, same position. After some few minutes, the patient will wake up. Once the patient is up, consider that this patient is not aware of anything that happened. They lost consciousness.
So you mean they usually don't know when it happens?
Yes.
But for Stephany said she can feel it, but
Yeah.
when it happens, she does not feel it.
So there are 3 stages for a seizure. One is the pre-ictal phase. The pre-ictal phase, some of them will feel. Some of them will have an aura.
Okay.
The aura means that something is about to happen. I'm feeling something abnormal. Some of them will have that, but some of them will not have that.
Okay.
Then we go to the ictal phase. Now the ictal phase is the active movement. During the active movement, if it is the partial seizures, they will still be aware, so they will not lose consciousness. And if it is the generalized, they will lose consciousness. So most of them will not be aware of the ictal phase.
Yes.
Then you go to the post-ictal phase. The post-ictal phase, some of them are not aware for like a few minutes. Then they recover. When they are recovering, they are not aware. They are even surprised that you are around. They are looking at them in a weird way. So they are also having that question, what just happened? So you have to explain to them, this and this happened. From that, they will understand that I'm usually having this. Maybe the attack came when I'm around.
Okay.
So you'll ask questions like, You ask them their name, you ask them where they are, and you ask them the time. You are just trying to see if their
Aware
consciousness is back.
Okay.
Yeah. So
Thank you,
after that, you just connect them to the person close to them, and you make sure that they are not alone. Because if the seizure comes again, that process needs to be repeated.
Okay.
Yeah.
Thank you, Daktari. Thank you so much for your insights. Thank you, Stephany and Samuel. We are taking a short break, and when we come back now, we'll talk about the misconceptions, which one of them is giving a spoon to someone or something to someone who is experiencing a seizure. And Nicholas has said, do not give anything to that person. Just loosen their clothing and put them in recovery position. When we come back, we'll talk about how to manage it and, of course, the myths that surround it. And Samuel and Stephany will continue to share their experiences with us. Do not go away. Welcome back. If you've just tuned in, this is the Health and Wellness Show. My name is Chebet Birir, and we are talking about epilepsy. Before we went on a break, we talked about the causes, the diagnosis, and how to manage it. And we're still there on how to manage it, and we are debunking the myths around managing epilepsy, as is, well known to many of you at home or wherever you're watching this. You've heard that someone who is experiencing a seizure should be given something like a spoon or kitu tu ya kumfanya asimeze ulimi ama asijiume ulimi. But Nicholas, who is an expert here on epilepsy, amesema do not do that. So Nicholas, tell us, why not? Like, we have grown up knowing that is first aid for someone with epilepsy, but why shouldn't we do that?
Yes, so basically many people put spoons and some materials within the mouth. The assumption is that you're protecting these people from biting their tongue or swallowing their tongue. You consider that the tongue is in a space. The buccal cavity is a space, and the tongue has its space on the lower side of the mouth. So when these seizures are happening, there is that muscle constriction and there is that uncoordinated movement. So when you are trying to put this spoon in the person's mouth, first you are causing injury to the teeth. Because you are forcing a piece of metal into their mouth. The second thing you are doing is you are forcefully, you are applying a negative force to the force that they already have. So chances that you'll break this jaw are very high. Then again, when you are putting this spoon there, you might position the tongue in a position where it will be bitten seriously. So you'd rather let it land naturally to where it belongs. There are some times where you'll get some bites on the sides, and they are not major. So once the seizure is over, you'd rather go to the health facility, get treated for the wounds, other than introducing even infections to the wounds that is already there by introducing these other stuffs that you're putting in their mouth. Yep. Okay.
Thank you. So now you know that you should not give anything to a person who is experiencing a seizure. And Nicholas has also said that, there's a position that you're supposed to put that person, which is their head raised. They should lie on the side, right, Nicholas?
Yes.
And then the upper leg, which after you've put them to lie on the side, should be on 90 degrees. That is to prevent them from turning over. Thank you so much, Nicholas, for those insights. Now, back to you, Samuel and Stephany. How has it been, managing the condition? Milisema it was until ulianguka kwa moto that now the community knew, but it was happening at night ukiwa watu wengine hawajui, maybe to the people close to you. But when it happened kwa public, ilikuwa aje, watu walichukulia vipi, na wewe umekuwa ukimanage aje hivyo?
When it happened in public, I think we were at home and we were in a funeral. So with our culture, mostly in funeral, we do sit round the fire, whatever.
Disco matanga.
Yeah. And then while we were there, people went away and they left me there. So I was sleeping. When I was sleeping, and then the seizure came. There was a person with around, but the guy was somehow, I can say, he was mentally disturbed. So he ran away. He ran away. Now when I started burning, even the clothes had already
Caught fire.
caught fire.
Pole.
And there was a voice. There was a voice that came out, and then people were in the house sleeping. One of them had the voice na akambia watu kuna kitu inafanyika nje, then wakatoka. After they came, walinipata nishaanza kuchomeka, niko kwa tanuru ya moto.
Wow.
So wakanitoa, mkono ishachomeka, nguo imechomeka. And the best thing is that sweta nilikuwa nimevaa ilikuwa imewaka hapa moto yote tayari. Lakini hii t-shirt ilikuwa haijawaka moto na ndani nilichomeka. Meaning this t-shirt ndio ilikuwa protection ya maisha yangu.
Niyo t-shirt umevaa saa hizi?
Not this one.
Oh, okay.
Ile kuna
Ulikuwa
ingine.
umevaa hiyo siku.
That day. So nikachomeka hivyo, watu ndo wakaanza kunitembelea kusema pole, kumbe unakuanga na condition sijui nini. Hii mkono tutatibu. Niliona dawa na aina, mwenye analeta jivu, mwenye analeta sijui matawi zimesiago, mwenye yani in order kutibu mkono. Na hii mkono bado haitibiki. Nilitibiwa na watu wengi sana hii mkono, na kumanage condition nilianza kuigundua after nimechomeka. Kasema ni nini nafanyanga, na meza dawa naanguka. Kaona maybe there's some things zenye sifanyi, maybe venye nakuanga kwa simu mpaka usiku. I should let my brain rest. So nikaachana na simu za smartphone. Kaanza kukaa tu na button. So nikapata mwingine expert pia akanifunza vizuri hizi triggers. So nikaona triggers, usingizi, stress, njaa na nini. So nikaona kumbe kumanage ni kufuatilia tu hizi prescriptions za daktari. So I followed up the prescriptions, na kufikia sasa naweza kuwa proud sana ya kwamba I'm now 1 year 8 months sijapata seizure, though I'm still on medication. Naomba Mungu anisaidie nifanye nini ni outgrow.
Asante sana Samuel. Hata mimi hapa kila mtu anaomba outgrow, and you are doing a good job kufanya awareness. Na Stephany, how was it for you now? Familia yako ilijua you were born with it. Wewe ulikuwa unajijua, but the first time other people like your friends, family, entire community walijua, how was it for you?
For me, mostly because I've been growing in a good family. They were knowing, and they were actually they were coming to see me when I have a trigger, if maybe I don't have a company at home. So they're usually ready to come and see or visit and even stay with me until I get better, because they were knowing how I am, how I'm coping with it. And after even learning about my triggers, I noticed the reasons why they were coming often. So I had to cut off things like the way I used to be a person who drinks. I stopped. Things like even knowing the way I was not sleeping well, the way I was not even eating well as the way it should be, and even knowing your ovulation and the hormonal imbalances, the menstruation were coming too much. So the way it was coming too much, it was due to the alcohol too. So with that, I had to stop, and it has improved
Okay.
my immune system.
Okay.
Yeah.
Thank you, Stephany. Tena utaendelea tu kutueleza, but let's hear from the expert. What are the triggers? Now, this first is for the people around this person.
Yes.
What are the triggers for epilepsy or for the seizures?
Yeah, so basically the seizures are so many. I'll first start with what Stephany has said for most of the time about hormones. There is a seizure that is known as a catamenial seizure. The catamenial seizure comes as a result of hormonal imbalance. You'll find that some people will have seizures only when they are about to get into
Their menses.
their menses.
Okay.
Some of them, the moment the menses start, they'll go into a seizure, and some of them will get into a seizure just immediately after the periods. Yeah. So what happens here is that estrogen increases your chances of having seizure. So when that transition,
does that mean women are at a higher risk of having epilepsy
exactly,
than men?
yes, progesterone at some point reduces your chances of having more seizures. So when that transition is happening, you'll find that when the estrogen is high, there are more seizures. When the progesterone is high, then the seizures are low. So that transition mainly affects them. And you'll find that there are things that we do during that period so that we make sure that they are okay even during that time. Then coming to the other seizures, the trigger factors are so many. They've mentioned some: anger, hasira, hunger, njaa, stress, lack of enough sleep, staying on the gadgets for like more than 2 hours can lead into a seizure, drug and alcohol abuse. We have sudden sound. Sudden unexpected sound can lead into a seizure.
Loud thunder.
Yes. Then we have surprises. They have surprises come in situations where extreme emotions will come in. You might be so happy and you might be so sad.
So things like loss, grief like over
can,
over loved one, death of a loved one.
Yes.
Or even
Birthday
good news
surprises.
like graduation ceremony. Or
Yes. So in case you're planning of something for them, like a birthday surprise, you have to tell them in advance.
So hakuna surprises
If
hapo.
you surprise them, they will surprise you with a seizure.
Okay.
So you have to really plan for them. We have things like infections. As much as they have seizures, they have flu. Flu can lead into a seizure. They have other diseases like typhoid and all these other conditions might lead into a seizure. So in summary, we always say that any stress is a trigger to a seizure. Stress can be physical and stress can be mental.
And
So
stress
both
can be good
and stress can also be bad.
Yes.
Yeah.
So avoid stress. Haitaki hasira, haitaki njaa, haitaki
Kuchoka.
pombe, sigara.
Kulala.
Hey, so how has it been? Umesema you were drinking, Stephany.
Hey.
Ikabidi uache pombe.
Libidi, because of me, I was taking too much. It was bad, but I had to, you know, when you are lacking or doing something, you have to stop it slowly. You can't just stop it like
abruptly.
Abruptly, yeah. So with that, I just had to cope. I had to pray, and Jehovah helped me. I am not even into it nowadays. I don't even like it. Yeah.
It is a good thing.
Yes.
And has it helped you manage the condition?
Yes.
Okay.
Yeah.
So do you remember the last time you had a seizure?
Yeah, I can. Actually, it was recently, last month.
Okay.
I had a problem with my potassium when I went to Mama Lucy. It was a bit low. So after being injected and being diagnosed, I got better. I have even lost 5 kgs. I even told the doctor earlier. So he had told me what to do. Actually, since last month, I've not gotten a seizure even when I was in my periods. Yeah.
Awesome.
Yes.
And you are strong and keep going.
Yes.
Samuel.
Yeah.
Umesema it's been 1 year, 3 months.
8 months.
8 months. Imekuwaje ndo ukamaweza kumanage hiyo period bila seizures?
Management ya seizures ina like doctor's prescriptions. doctor's prescriptions, it always has rules
And regulations.
regulations.
To follow.
If you don't follow, then you be ready.
For a seizure.
Yeah. One, kumeza dawa on time. If it's 7, let it be 7. Ukiwa unaenda kuwatch ball, usiseme wacha nimeze 6:45, 7 itanipata hall. Beba uende umeze huko.
So lazima ikuwe strictly at the same time every day.
Strictly at the same time. Simply, ile dawa ulimeza jana ama the other time, ikifika hiyo time inakuanga imeisha. So inafaa iishe ingine ingie.
Na ni dawa ngapi unameza? Najua Nicholas atatueleza hizo treatment options zote, but wewe saizi unameza ngapi kwa siku?
Mimi sahi nameza 2. Though kitambo I used to take 6
tablets. Ama plus syrup.
6 tablets evening, 6 tablets morning.
Wow.
So management ya epilepsy na seizures it falls on doctor's prescriptions.
And it's individual.
Mostly triggers. Where akikwambia trigger, wewe mostly unaweza kosa kugundua trigger yako, but ukielezea daktari it happened when I had done this and this, he will come to know this might be your what.
For you, wewe triggers zako ni gani?
For me niyo niseme kutokulala usingizi wa kutosha. Na ingine njaa. So uko na food constantly. I represent my
community.
My community.
Ugali lazima.
My tribe, you know.
Your tribe.
Sasa njaa hiyo ni trigger yangu kubwa. Alafu trigger kubwa ni missed medication. Ukikosa kumeza dawa, whether umekula vizuri, whether una stress, you have to be sure that you will do what? You will have a seizure.
Okay. Na hasira, wewe ulikuwa na hasira before?
Hasira kwangu, kwangu hasira ni kitu nomo. Hiyo lazima ni hiyo
uko na hasira
vibaya sana. But uzuri ni hasira yangu haijawahi niletea seizure.
Okay.
Sijawahi pata seizure
after anger.
Because of mtu amenikasirisha or because of I've been in a bad condition or in a bad water. So hasira ni trigger, but you know triggers varies. So kuna kitu ingine yenye naweza sema imenisaidia pia ni kujikubali. Accepting yourself. You know, after you've accepted yourself, you also accept the condition and you say you are the one to drive it, not it to drive you.
Awesome.
So that is the thing that has done what? That has helped you. You control it, not it to control you.
Interesting.
So
that's a very good perspective.
Ni kitu ya muhimu sana na nishaikubali. That is why inaelekea ikienda. That is why inaelekea ikienda. So mimi nabaki ku create awareness. I'm an epilepsy ambassador.
Awesome. Na tutarudi hapo, but Nicholas, tueleze what are the treatment options, like umediagnose epilepsy. What are the treatment options for, is it different for men and women ama ni the same too? Na pia ina vary from one person to another ama ni the same?
So basically for the management, you first have to categorize the types of seizures. I had talked about the partial and the generalized. The partial kuna 3 types: simple partial, complex partial, and the general simple, complex, generalized. That is partial. Then kuna generalized. Kuna absent seizures, kuna tonic seizures, kuna tonic-clonic seizures, kuna clonic seizures, kuna myoclonic jerks, na kuna atonic seizures. In total, there are 8 types of seizures. So first you have to identify the type that you are dealing with. After identifying the type that you are dealing with, that is when now you can identify the type of medication that works for a specific type. That is why we always discourage people from, mimi nakuanga na shida ya kuanguka na wewe uko nayo, wewe si hauna dawa, tumia yangu.
So you cannot share medication.
You cannot share medication because the seizures are different and the medications are also different. There is a medication that if I give a person with absence seizures, instead of the seizures going down, they
They'll
will go
come
up.
up.
Yeah, so you have to really make a proper diagnosis before deciding on the type of medication. There is this assumption that the diagnosis of epilepsy is very expensive. And that is a thing that has been there for so long. Epilepsy can be managed within the primary healthcare system.
Public hospitals.
Yes. And our campaign as the Kenya Association for the Welfare of People with Epilepsy, we are focusing more on making sure that all patients can access epilepsy management in the primary healthcare system, meaning that you can make a diagnosis through history and physical exam. The imagings and the lab tests will only come when very necessary. But I can make a diagnosis with history and physical exam, which can happen even in the dispensary if proper training is done to the primary healthcare team and the facilities that are required for that management are available.
Thank you, Nicholas.
Yep.
We'll come back to you for the parting shot because unfortunately we have very little time left. So Samuel, tutatuelezea what you are doing. Umesema wewe ni epilepsy awareness champion. What is happening in Kenya and what are you doing as a champion to ensure that, you know, the treatment is better, the diagnosis is better? Same with you, Wanjiru, utatueleza. Are you a champion? And even if you were not before, now you are because umekuja na umeongea about it. So utatueleza what needs to be done. Ama just your parting shot because of the little time that we have left. But thank you so much for coming. Tuanze na wewe Samuel.
Thank you very much. I personally, I'm doing awareness. I'm giving awareness to every Kenyan I come across, because I believe that when I teach one person, he or she will
Teach
give an
person.
information to many.
Yes.
So most of the time, even tomorrow, I and my team will be at Baraka Hospital Center there at Madare. We'll be creating awareness. The same way on my Facebook page, each and every morning I give awareness, I create awareness. I give how the epilepsy is diagnosed, how it is managed, and also how a person can cope with it. And also apart from that, mimi mwenyewe nikiwa kwa kazi yangu, nikipata mtu yeyote mwenye amekuja kwa idol kwa kazi yangu, na muingiza kwa class so that yeye pia akifika kwingine apeane information.
By force, by fire.
By fire, because I want to fight it. And hata mwezi wa 5 nilienda Busia. I went back home kuelimisha watu. I met around 9,000 people.
Wow.
I created awareness.
Sawa.
I'm very much sure that my community is now.
Tungependa kusikiza zaidi, but because of time. Asante sana, of course, for the good job that you're doing and keep at it. Unaelimisha watu wengi sana na unasaidia watu wengi. Asante. Stephany?
Me, what I can say, with this journey, it was not easy, but I've coped, I've helped, I've even taught wherever I go.
Yeah.
So with that, I know that with time it will be well, and people nowadays, they are not that scared because of the learning. And the way we have our own team, at least you have learned, we are teaching other people well. Accepting even yourself is very important. So with that, it has helped me to improve in a good manner and in a good way. And I thank Jehovah for that.
Thank you, Stephany.
Yes.
Of course, keep up with the good job and keep spreading awareness. Last but not least, Nicholas.
Yes, so basically our clerical call is usually epilepsy is treatable. Epilepsy is treatable, and the reason why we are having so many cases that are not treated out there is because of the myths and the misconceptions. Once we demystify these myths and misconceptions, people will come to the health facilities. Another thing is that when they come to the health facilities, they are supposed to find the personnel at the health facilities who are able to manage epilepsy. Because we've had cases of misdiagnosis in health facilities, and when a misdiagnosis happens, the news spread, and these people will go back to the myths and misconceptions. So what we are doing is basically we start by creating awareness. After the awareness, we make sure that the primary healthcare providers are trained. After they are trained, we make sure that they are doing follow-up. And in the follow-up, there is usually this issue here, the county health management team not having a budget for epilepsy. So we make sure that we meet the county health management team, they do the budgeting.
Yes.
Then this budgeting goes to the county assembly, the health committee. So we also have to go to the county assembly to talk to the persons at the county assembly, so that when they are making these decisions of diverting the funds for epilepsy, they are aware of what epilepsy is, so that these funds can be approved, and persons with epilepsy can be managed.
Thank you, Nicholas. I'll have to cut you short because of time, but we've gotten your message. Financing is a major issue for epilepsy. Samuel amesema kujielewa, kujikubali, sticking to medication, haitaki hasira, haitaki pombe, haitaki stress. So if you've been diagnosed with epilepsy, you have the information that you need to manage the condition better. Of course, if you know someone with epilepsy, do not judge. It's not uchawi ama urogi. It's a neurological condition that can be managed. Thank you so much for tuning in. My name is Chebet Birir. Have a lovely evening na tuonane tena next week. Mungu akipenda.